and the number 1 on your telephone keypad. Please be advised that today's conference is being recorded. If you require any further assistance, please press star 0. I would like to hand the conference over to your speaker today, Andrea Alman. The floor is yours.
Thank you. Good afternoon, everyone. Thank you for joining us for the COVID-19 media call for July 6th. My name is Andrea Ahnemann with the Minnesota Department of Health Communications, and we will start today's call with a situation report and some updates from the Health Commissioner, Jan Malcolm. We also have State Epidemiologist and Medical Advisor Dr. Ruth Linfield on the line for today's call. After those updates, we will open for questions from reporters on the line. And with that, I will turn it over to Commissioner Malcolm.
Thank you, Andrea. Good afternoon, everyone. I hope everyone had some enjoyable and restful times on the hot July 4th weekend. As of early this morning, around the world, we were at over 11.4 million cases and over 534,000 deaths. In the United States, as of this morning, we were at almost 2.9 million cases and just under 130,000 deaths. We're seeing now a daily rate of increase of 40 to 50,000 cases per day in the United States. It's been widely reported that this is the fastest growth rate we've seen yet in the pandemic in our country. Here in Minnesota, today we are announcing Sunday's total of 38,569 laboratory-confirmed cases in Minnesota. This is up 434 from the two-day results that we announced yesterday on Sunday. We added a total of 1,359 cases since our last report to the public last Thursday, or the last report since this media call, I should say. Since we did not report data on Friday, it might be useful to look at the average over the three-day weekend. There were an average of 11,500 tests processed each day and an average of 450 positives each day. Over the last week, we saw a 14.9% increase in the number of tests and a 7.6% increase in the number of positives. So that is the ratio that we hope to continue seeing, more tests and a lower rate of positives than the rate of increase in tests. However, our 7-day rolling average case positivity rate is now up a little bit. It's now at 4.0%, up from 3.6% 1 week ago. The median age of Minnesota cases is continuing to steadily decline and is now at 38.4 years old, compared to 41.5 years old at the beginning of June. Really quite a notable drop in a month's time in median age. Some of the counties that we have been watching with some concern in greater Minnesota seem to be slowing down a bit compared to last week, so that's good news. We are now at a total of 1,474 deaths in Minnesota from COVID-19, up a total of 8 over the long weekend. There are currently 258 patients in the hospital, 125 of those in intensive care. I'd like to talk just for a minute about some of the measures that we are tracking most closely, the so-called dial-back measures that the governor announced in early May. We've been following a number of key metrics since that time, since early May, to help us evaluate the rate of new cases and to track how the virus is spreading as things have been opening up across the state and as external events, including what is going on now in other states, may impact us. These dial-back measures are kept up to date on the COVID-19 dashboard and also on the MDH dashboard. We have a couple of updates to those measures that we are just rolling out today. First, we've updated and increased the threshold for tests per population per week. The prior threshold was that we wanted to see testing per population above a certain level, and that prior threshold was 50 tests per 10,000 people per week. And we've doubled that threshold. The new threshold is 100 tests per 10,000 population per week. The reason we made this change is because as testing capacity has continued to expand, we thought that this was a more appropriate and reflective measure of where we actually are, and we wanted to keep the bar high on expected testing across the state. 2 weeks ago, as you know, we reached over 16,000 tests in one day, our high point so far, which equates to 200 tests per 10,000 people per week. So well over that new target of 100 tests per population per week. Statewide, we've been over the 100 test per week threshold for at least 3 weeks now. And we do keep track of these metrics by region as well. And all regions except one are above that new threshold. So again, we just are kind of raising the bar, wanting to keep our sites very focused on a robust level of testing. We've also added a new measure that we're beginning to look at to track case growth, and that is replacing the case doubling time measure. The reason that we're making this change is because this new measure, new cases per population, is a better way to look at where we actually are in the epidemic. That case doubling time was more instructive earlier on in the epidemic when we had fewer cases, and a doubling time reflected more than it does today. So the new measure is the rate of new cases per 100,000 people averaged over 7 days. Our threshold for this measure is 5 new cases per 100,000 residents, again, averaged over 7 days, excuse me. So looking at new cases rather than the case doubling rate makes it easier to identify outbreaks or increases in cases faster than the doubling rate, which is a slow-moving measure. Now, statewide, we are above this threshold. We are at 7.7 new cases per 100,000 residents, and that's the rolling average over the last 7 days. That's about 435 cases per day. Our threshold of 5 new cases per 100,000 is equivalent to about 283 cases per day. Another advantage of this measure is that it's population-based. So you can compare regions to each other in terms of the rapidity of case growth. And we're watching this new measure and all of the dial-back measures very closely. These are an important reminder that we have to keep on taking preventative measures to slow the spread of COVID-19 in our communities. Particularly, I would say, as we observe what's going on in now the great majority of the states in the country. This includes staying home if you're sick, washing your hands often, getting tested if you have symptoms or have been in contact with someone with COVID, and staying 6 feet apart from others whenever you go out, and wearing a mask. That concludes my comments for today. So back to you, Andrea.
Thank you, Commissioner. And we will now open it up for questions, and we ask that reporters limit themselves to 1 primary and 1 follow-up, and that we limit the number of questions from each outlet so we can get to as many as possible. With that, operator, we are ready to take questions.
At this time, I would like to remind everyone, in order to ask the question, kindly press star and the number 1 on your telephone keypad. We will pause for just a moment to compile the Q&A roster. Your first question comes from the line of Bill Warner from Minnesota News Network. You may now begin to ask your question.
Okay, thank you. Commissioner, given this new measure, which is number of new cases per 100,000 people, and I know that you have only got, I suppose, a week's or so worth of data on that, can you tell us how Minnesota is doing relative to the rest of the nation? Are we looking like we might, if not avoid a resurgence, at least tamp it down somewhat? And the second part of that question is how key is wearing of face coverings to that?
Thanks, Bill. Both good questions. And this is a new measure we're just releasing for the first time today. I do not have at my fingertips, and Dr. Linfield might, but if not, we will report on that the next time we're together in terms of how this particular metric compares to other states. That actually is one of the reasons also that we thought it would be useful, is that CDC uses that as a measure as well. So I don't have that comparison just yet. Dr. Linfield, do you happen to know anything about national averages on that score?
Yeah, there certainly are many states that have been experiencing increases, and those have included increases above that number that we are experiencing. In fact, I believe that New York and New Jersey and Connecticut had talked about asking people to quarantine if they came from an area that exceeded 10 per 100,000 on a 7-day rolling average. So it is a measure that people are starting to take a look at and to utilize.
Do you have any?
And Bill, you're
yeah,
sorry, Bill,
I'm wondering. Yeah, so do we have any idea how well we're doing relative to other areas of the country, or is it too early to tell? And also then the issue of masks or face coverings.
Right. I will get back to you on any comparisons on national averages on this particular new case metric. And on masking, I don't know that there's anything as granular as to correlate masking requirements with case growth, but it certainly is one of those protective measures that, in combination with the other measures that we keep talking about, the evidence just has continued to accumulate on the effectiveness of masks. And Dr. Linfield may want to comment a little further there.
No, I agree. It is certainly there are more data coming out, and we really do encourage people to be wearing masks. We think it is very important for source control. And we do think that it may also provide some benefit in terms of protection. And so we certainly want to make it an expectation that if you're going to be near someone who's not from your household, particularly in a confined space, that is the appropriate thing to do, along with all the other measures. I mean, we still want people to keep a 6-foot distance as much as they can. We don't want wearing a mask to make people feel that they're invincible and so that they don't have to keep a distance. So we still want people to keep a distance. We want people to wash their hands, etc., stay home when sick. But we do feel that masks really are an important tool. Thank you for the question.
Thank you both.
Your next question comes from the line of Matt Setek from Minnesota Public Service News. You may now begin to ask your question.
Hi, Commissioner. I'm wondering, are we seeing fewer deaths and ICU admissions in Minnesota because the median age of positive cases is dropping, and presumably people who are better able to fight off COVID-19 are the ones catching the virus in larger numbers?
Thanks, Matt. Yes, I think Dr. Hick and Dr. Linfield commented a little bit on that last week, that as we see the cases skewing younger, we are seeing a higher proportion of the hospitalizations being in the non-ICU level. Whether that will continue certainly remains to be seen. And the improvement, the lowering of the mortality figure, certainly on a per population basis, that would be affected by the increasing number of cases among younger folks. But even just the absolute number of cases is declining, which we think is influenced in part by the progress that we've reported on in control of the outbreaks in some of our congregate care settings, which we certainly can talk at greater length about in a future call.
And to follow that up, I noticed in our data that we're following, based on your data, there is quite a spike in the percentage positive cases reported today. Any reason for that, or is that just because of the way data were reported over the holiday weekend?
Yeah, I do think some of that has to do just with the fact that we did not collect or report data on Friday, and that's why I was kind of referencing the average over the long weekend as being perhaps more indicative. But it still is a tick up in total case positivity rates over the prior week, as I mentioned. Ruth, anything to add there?
No, I think you covered it.
Okay, thank you.
Your next question comes from the line of Darren Sevenson from K2E Radio. You may now begin to ask your question.
Thank you. Piggybacking on the death total, 3 reported today, 8 over the weekend, regarding over the last 2 days in the state. Now, 13 of the last 15 reporting dates have had single-digit deaths here in the state. That's a 2-week period. How comfortable can you say that things, at least when it comes to the mortality rate, are moving in the right direction, having single digits for that long of time?
I'm going to ask Dr. Linfield to comment on that, but again, there was a really good discussion with Dr. John Hick and Dr. Linfield on one of our daily calls last week that I think maybe we might that was the day that we had our press call an hour before the governor's might have been more lightly attended. So I think I'd like to repeat some of that because Dr. Hick was talking and Dr. Linfield too about improvements in treatment as we've learned more about the virus. So I'd be interested in their take on kind of the degree to which the mortality rates are improving as care itself is improving. But again, it's also, I think, due to some really hard work and good success in the congregate care settings. Ruth, would you like to comment any further?
Sure. I think that's right, that it's a combination of different things that are occurring. Number one, that there has been a lot of work done in long-term care facilities to enhance their work on infection prevention. And I think that is making a difference because certainly it is our elderly and those with underlying conditions which make up the people who are in long-term care. When they get infected, they are the folks that are at highest risk for dying. So improvements there go a long way. And so improvements in being able to detect infections and to follow these residents and to prevent spread is so important. Another observation, as folks have mentioned on this call, is that we are seeing younger people beat cases. And so they are less likely to have severe disease. But I want to caution everyone, including the young people, that this is a infectious disease and they can spread it to people who may not do as well as they. And so we do want to really ensure that people use prevention measures. And if someone is not feeling well, they really need to be careful about the people that they are in touch with, including in their households. And then to touch upon the improvements in treatment, there have been a number of approaches that people have learned over the past number of months in how to improve the care for these patients. And that has certainly I think made a difference in terms of things like using prone position, in terms of having some additional medications available, such as dexamethasone, such as remdesivir, such as various medications that can clamp down some of the hyperimmune responses that we see, such as we know more about the complications, including clotting complications, so that we are looking for them, and we are using various tools and medications to prevent them.
And you bring up long-term care facilities. I know, I believe the state standard, if you have one case, you're treating it as an outbreak. Are you seeing less facilities with outbreaks and with cases over these last, I guess, month since you put in new initiatives in long-term care facilities? Do you have any specific data regarding that?
Yeah, we do. And I think, again, I'd like to get some other folks on the call to maybe go a little more in depth on some of these trends. But we, as you know, that we need to be clear when we're defining or how we're defining our terms. We have taken a very inclusive approach to what we consider to be a congregate care facility or a long-term care facility that includes skilled nursing facilities, assisted living facilities, group homes, adult foster care, mental health and substance abuse treatment centers, memory care, hospice. So we've had a broad set of facilities that fit that congregate care definition, where by definition, folks have some underlying health conditions and live in close quarters. So when we look at those metrics, we also see stabilization and improvement pretty much across the board in all those different types of settings. If you look specifically at assisted living and skilled nursing facilities or nursing homes, which is what I think people more commonly think of when we're talking about long-term care, we do see pretty significant improvements, both in the number, seeing fewer numbers of new facilities reporting cases, but also among the facilities that have or ever have had confirmed cases. We're seeing that a pretty good majority of them are what we would consider to be stable, meaning they've not had any new cases in at least a week. In the case of the skilled nursing facilities in particular, it's 80% of the facilities that have ever had a case haven't had any cases in the last week. And then there's another category that we refer to as controlled facilities, where there have been no new cases in a month, and that's at 38%. So we definitely do have the metrics to indicate that more facilities are better able to control outbreaks when they happen. And we have said before, and we'll keep on saying, even though it still is the case that the majority of assisted living and skilled nursing facilities in the state haven't had a case, we really need everybody to be prepared to manage cases, because just with the ongoing presence of COVID in our communities, we'd say it's more likely than not that most long-term care settings will experience a case. So really working hard, and the facilities are really working hard to have good response plans in place. And certainly the testing capability that's been built and the approach to universal testing when there is a case has very much helped, as Ruth said before, to detect infections more quickly and to stay on top of monitoring them.
Thank you.
Operator, are there any more questions?
Operator, we're ready for the next question.
I thought I heard a disconnect. I don't know whose line that was that disconnected. Perhaps it was the main line.
Yeah, apologies, everyone. One more call for the operator. Do we have any more questions on the line?
This has been a WDIO News Special Report.